Hello everyone and welcome to EduSearch Clinics. I am Dr. Gunjan Desai. I am a consultant GI and HPV surgeon at Leelavati Hospital, Mumbai. And today we are going to discuss some very basic points on risk factors and prevention of liver cancer. So very commonly asked questions from a lot of our patients, what the liver does in the body, why it is an important organ, what are the risk factors that can predispose to liver disease and liver cancer, and towards the end, the signs and symptoms of liver disease, which can help you reach your doctor early. And then we look at prevention and screening options for early detection as well as preventing liver cancer if that's possible. So let's see. So first and foremost, let us just revise the basic anatomy. I'm sure most of you know the liver is located in the right upper part of our body, extends centrally and crosses the midline, the right and left side of liver. This is the common digestive tract diagram that I am sure most of you have seen, and this is where the liver is located. For us, if we imagine this system in isolation, it is the liver and the biliary tree. We have discussed biliary tree and gallbladder in a separate video, but this is the liver. So what does the liver do? This is a very commonly asked question. And if you understand this, you know that what happens when liver fails. Understand that most of the nutrients of food reach liver through blood, and liver is basically the most important factory or warehouse of the body where it processes these nutrients and produces one of the most important building block of our body, that is albumin. So liver essentially breaks down nutrients and produces protein. Albumin is basically the protein. Another important function of liver is that it metabolizes almost all the medicines that you are going to ingest. It metabolizes the alcohol, and that is why it is said that alcohol can harm your liver, because if you consume alcohol in large proportions or if there are enzymatic deficiencies in your liver, then the alcohol can be very toxic to your liver. As we have seen in the video of gallbladder also, liver produces bile, and it is this bile that helps in fat digestion. It helps in toxin removal through the enterohepatic circulation of bile, and it helps in absorption of fat-soluble vitamins. Liver also produces some immune substances for the body and helps fight infection. Vitamin K helps in production of clotting factors through liver. So all these are important functions of liver. You can see from supporting the energy needs of the body to production of protein, which is the building block for the tissue injury and repair. Bile, which helps in toxin removal, metabolism of medicines and alcohol, fighting the infection, that is immunity, and clotting. So a lot of important functions that liver does in our body. And so it's obvious that if liver fails, then it's a very difficult thing to manage. So what are the risk factors for liver cancer? If there is a single word that you can remember, it is cirrhosis of liver or chronic advanced liver disease. And this disease, in most common risk factor for liver cancer, is due to hepatitis and alcohol. So when you call the term hepatitis, it is very important that you remember some very important symptoms of hepatitis. Most common is fever, loss of appetite, pain, jaundice, and weakness, easy fatigability, being tired throughout the day. These are some of the common symptoms of liver disease. Okay. So when we talk of risk factors for liver cancer, we are talking of risk factors for cirrhosis and basically hepatitis infection. So there is hepatitis A, B, C, D, E. We are looking at long-term or chronic hepatitis B as a risk factor for liver cancer, which is more common in Asia and Africa, whereas chronic hepatitis C is more common in US and UK. Just for those who don't understand hepatitis, just like COVID virus, hepatitis is also a virus. Its types are A, B, C, D, E. As far as cancer is concerned, is chronicity, which is due to hepatitis B in Asia and Africa, and hepatitis C in US and UK. Understand that hepatitis C has more risk for liver cancer than hepatitis B. Both can spread through contaminated needles and unsafe blood transfusion, unprotected sexual intercourse, and mother-to-child transfusion during childbirth. Now, Because we know that these can spread through these modes, there is scope for prevention. And this is very important. A lot of people ask, can cancer be prevented? Cancer can be prevented only through prevention of risk factors or taking care of risk factors, right? So contaminated needles, unsafe blood transfusion, already a lot of efforts are going on to prevent this. But if you are doing these things at centers which are not accredited, then this is where problems can arise. Unprotected sexual intercourse can be reduced through awareness, and mother to child transmission can be prevented through better maternal and child healthcare programs. There are vaccines available for hepatitis B. There are medicines that can cure hepatitis C. So these are some of the ways in which you can prevent. Other risk factors, as you all know, most important risk factors are alcohol and smoking. They are risk factors for all the cancers that we are going to discuss in the gut. A lot of risk factors for other cancers in the body as well. Anabolic steroids, a lot of the current gymming generation resorts to steroid use. They have been banned by a lot of authorities, but still they are being used, help get into shape, but also lead to cancer. Obesity, type 2 diabetes, and fatty liver is non-alcoholic fatty liver disease, or what is now known as metabolic syndrome associated fatty liver disease. A common risk factor for liver cancer, and alcohol and fatty liver may surpass the hepatitis as the cause for liver cancer in future. Aflatoxins are basically fungus related vinyl chloride chemical exposure are also risk factors. Like we saw in gallbladder cancer, so in liver cancer, gender, males are more predisposed, and hereditary and metabolic disorders that cause cirrhosis and liver disease can also lead to liver cancer. Again, there is scope for prevention when it comes to alcohol, smoking, obesity. You can have alcohol and smoking cessation as a goal and moderation as a target. Physical activity, exercise, control of diabetes, and healthy lifestyle. These are basically the ways in which we can prevent some of these cancers. A lot of people ask this question, how to suspect and identify liver disease, where there are specific symptoms and signs that the body provides that it needs help. Jaundice is one of the most common sign of liver disease. Yellow eyes, dark yellow urine or skin, white or black stools, and itching. These are the common symptoms that you may see. Unplanned weight loss and anorexia. I always say that if there is loss of appetite and unplanned weight loss, you're looking at a disease affecting one of the gut organs. Easy fatigue, tiredness, and weakness are common symptoms of liver disease. There may be a lump in the abdomen. On the right side, it's liver. On the left side, it's spleen. Nausea or vomiting may or may be present with blood. Fever and pain in abdomen are also symptoms. If a patient is a known case of liver disease, the patient needs to be on surveillance. And in these persons, if there is worsening of symptoms, say a patient was pain-free or jaundice-free for a long time, and now starts having jaundice, very classical sign of harboring a liver disease. So pre-existing liver disease patients need to be on close surveillance. And this is very important to prevent cancers or at least detect them early. Coming to prevention strategies for liver cancer, we have already seen hepatitis can be controlled by immunization. There are vaccines for children, for healthcare workers, as well as for all family members of patients with hepatitis B. And this in itself can reduce the liver cancer burden by at least 10 to 15%. Lifestyle and diet can reduce the incidence of alcohol and fatty liver related liver cancers. The principles are to look for weight control, have a goal of alcohol and smoking cessation, physical exercise at least 30 minutes alternate day, and treat diabetes and control obesity. Understand that if you are going to good hospitals, ensure safe injections and safe blood transfusion practices, infection control at all strata in hospital, and this is very important strategy to prevent liver cancer. How to identify issues early, understand the things that are presented in this video, understand the symptoms and risk factors. If you have them, meet your doctor as soon as possible. All patients with pre-existing liver disease. So if you have liver cirrhosis due to any cause, then you need to be aware that you have to be on a surveillance program. screening and surveillance are the only way that we can achieve an early diagnosis in patients who already have pre-existing liver disease. Screening usually is with ultrasound and alpha fetoprotein, but based on your condition, you may be advised a CT or an MRI. And child and male scoring are common markers, scoring systems that we use for looking at the extent of liver disease and then planning the screening and surveillance protocols accordingly. Is liver transplant a prevention tool? We don't know. But if you have chronic liver disease that entails a transplant, then definitely that is an answer to treat liver disease, but that does not apply to all the patients. So have a consult with a hepatologist, a liver surgeon, other than a transplant surgeon as well, and take a joint opinion, take discussions with these doctors, and then come to a conclusion as to what is the best plan for your disease. Thank you.